best defense we have is for everyone to go out and get vaccinated. And we have highlighted the serious risk that you are taking when you make the choice to not get vaccinated. Now, I'm not going to go through and review all of the data that clearly demonstrates the majority of new cases and hospitalizations in this province are in those that are unvaccinated. That data is freely available for everyone to access. Instead, I'm going to talk a little bit about the impact of your choice to not get vaccinated. By choosing to not get vaccinated, you are choosing to put yourself at increased risk, yes, of getting COVID, and a significantly increased risk of experiencing severe outcomes from this virus. But your decision to not get vaccinated is no longer just impacting yourself. By choosing to not get vaccinated, you are increasing the risk to those who don't have a choice. For example, our children under the age of 12. And by choosing to not get vaccinated, you are now placing tremendous strain on our health care system. We're filling up our ICU beds, and we are burdening many of our healthcare workers in this province. That is the reality of the choice that the unvaccinated has faced this province with. It puts our government in a position of expanding capacity in our healthcare system to deal with a surge in both cases of increased severity and increased symptoms, almost entirely those are in unvaccinated individuals. So today we are announcing that Dr. Shahab will be enacting a public health order that will mandate anyone that tests positive for COVID-19, they will be required to self-isolate for 10 days after receiving that positive test result. Also, the public health order will require those that are close contacts of an individual that is tested positive for COVID-19 and are unvaccinated will also be required to self-isolate for 10 days. But if you are fully vaccinated and identified as a close contact of a positive COVID case, you will not be required to self-isolate, but you will be required to self-monitor and to seek testing, of course, at the first sign of any symptoms. This is one more measure that we can take that limits the spread of COVID-19 in our communities while recognizing the proven efficacy that the vaccines are providing. I've also met over the course of the past week with the CEO of our Saskatchewan Health Authority, Scott Livingstone, Ministry of Health officials, and Dr. Shahab, of course, to prepare a plan to address the issues that we are currently experiencing in our health system operations and addressing the capacity issues that we see before us. Previously, the provincial emergency order included provisions for greater flexibility and agility for the Saskatchewan Health Authority to ensure that they can address all of the staffing challenges and all of the staffing pressures that they are experiencing within the system. It ensured flexibility in scheduling and placement of our healthcare workers so that we could place them in areas that are experiencing surges in capacity. Our preparations for COVID-19 have ensured that we do have ample bed space, we do have the critical equipment in place, and we do have all of the resources that are required. But an ICU bed and a ventilator are just equipment, and we have that. But what we need are our frontline healthcare staff there supporting patients should they require care. And time is of the essence. In July alone, for example, we saw over 17,000 shifts go unfilled in our healthcare facilities across the province. That's an increase of about 160% over July previous. We have to ensure that the Saskatchewan Health Authority has the ability to place staff in our most critical areas and be responsive to emerging needs that arise each and every day. To this end, the Saskatchewan Health Authority has recently entered into discussions with all of our provider unions over the course of the last number of weeks in order to reach an agreement and to deal with this issue. As of today, talks with our provider unions are still occurring and they will continue to occur throughout the weekend, I'm sure. However, if these talks do not lead to an agreement shortly, the government of Saskatchewan is prepared to sign another provincial emergency order to reactivate the provisions that support emergency labor mobility. That will occur on Monday, September the 13th. We are also immediately procuring resources from the private sector to provide additional support in our healthcare services to the people of this province. The Saskatchewan Health Authority, the Ministry of Health are moving to expand both testing and contact tracing services by private third-party providers. This will not only help preserve the capacity in our system, but it will ensure that these services are widely available to the public for the foreseeable future. And this will also ensure our healthcare workers are able to stay at the front lines where they are most needed at the moment. In conjunction with the expanded testing options, further rapid testing resources are going to be made available to Saskatchewan residents, including self-administered tests. We've secured an additional 1 million rapid antigen tests from the federal government. The first shipment of 500,000 of those is set to arrive next week. These tests will again be used to support the Saskatchewan Health Authority's Test to Protect program, and will be made available to long-term care, personal care facilities, shelters, group homes, schools, healthcare workers, dentists, first responders, as well as pharmacists. But expanding testing options must be paired with preserving the capacity, as I spoke about earlier, in our healthcare system. And unfortunately, to preserve that capacity and to free up staff within the system, the Saskatchewan Health Authority is in a position of needing to reduce some of our healthcare services in the province. This reduction in services will look similar to what it did look like in our initial response to COVID, and it will focus on non-critical or elective services. And we understand the toll that this may take on people and the frustrations of having to wait or to postpone an elective service. So in order to help offset the impact of this, we have purchased 8,500 MRIs and CT scans from private providers, and we will start immediately to provide 2,300 additional appointments in some of our smaller diagnostic centers. But we know that these are only interim measures that will increase our healthcare capacity in the short term, so we must continue to focus our efforts on increasing the efficacy, the availability, and the uptake of vaccines. We've made vaccines widely available in every part of the province. At pharmacies, we had appointment clinics, we've had mobile clinics, we've had drive-through clinics, we've had pop-up clinics, we've had worksite clinics, we've had clinics in the parking lots of malls, we've had clinics at our schools, and now at our post-secondary education centers across the province. And this effort to provide access, this is all in an effort to provide access to all Saskatchewan people, and that will continue into the future. Vaccines are available and they are widely accessible in Saskatchewan and continue to be today. We need to ensure that our vaccine efforts are responsive to emerging issues such as lagging vaccination rates in certain sectors or certain regions of the province, and addressing some of the breakthrough cases also in the fully vaccinated. So this week we've commenced administration of booster doses for our most vulnerable in our communities, those that are immunocompromised, as well as our long-term care residents, and those are occurring as we speak. Beginning in October, in conjunction with our provincial influenza vaccination campaign, booster shots will then also be made available to our seniors population in the province, and then eventually to our broader vaccinated population throughout the course of the next winter. And Dr. Shahab and senior health officials are working on what the final eligibility for boosters and the sequencing of those eligibility groups will be based on the best scientific evidence that we have available. So details on the timing and the eligibility of boosters will be made public in the next number of weeks, and it will be contingent also on a strong supply, a federal supply of vaccines into the province. We also need to ensure that critical sectors like our healthcare sector are vaccinated to the fullest extent possible. This is in order to, yes, preserve the workforce capacity that we need, also to prevent further outbreaks and to protect our vital frontline healthcare employees and their teams, but also our family members that they serve. And that is why the Saskatchewan Health Authority is currently working on a policy that would require a proof of vaccination or a proof of testing to all of its employees across the province. Consultation with key stakeholders is currently underway, and details on the timing and the implementation of this policy will be made available in the next number of days. We're also working to address the lagging vaccination rates in certain regions of our province and we are currently experiencing, and this is resulting in higher case growth also in certain areas and regions of the province. Also higher hospitalizations coming out of some of those, the residents in those regions. So over the next number of days, ministers and health officials will be actively speaking with community leaders in various regions of the province to explore options where we can continue to work together and maybe accelerate our efforts to increase options and to boost the vaccine rates in those areas. And I want to thank the community leaders who have reached out to all the government members, to myself and to the minister, of course, to help set up these important discussions. Today, we're also announcing that Saskatchewan's verifiable record of vaccination is in its final stages of development and will be launched during the week of September the 20th. This is the proof of vaccination QR code. While we will be providing more information on how to access this service in the coming days, residents who are currently registered for our eHealth, registered online with the eHealth Saskatchewan's My Sask Health Record report, and many of you have seen that, they will be able to download the app that is linked with your vaccine record, and that will provide you with your very own unique QR code that you then can produce as you choose. A separate app then can be downloaded to provide venues and organizations with the ability to securely scan those QR codes to verify individuals' vaccination records. So we'll both have the individual QR code as well as the scanning application available. We're implementing this system in order to provide a secure and verifiable proof of vaccination for those municipalities that we have seen have moved in this direction, universities, post-secondary institutes moving in this direction, as well as any other organizations that have moved to implement the proof of vaccination or ultimately a proof of a negative test. So lastly, I would just say this. This fourth wave is concerning for all of us. In particular, I think it's most concerning for our healthcare professionals who are experiencing firsthand the pressures each and every day and the pressures that our system is feeling. And I know some of you may be here wondering why I'm not imposing broad restrictions and mandates here today, and I've said before, restrictions are a stopgap measure. They were always intended to be temporary, and they were to get us to a point where vaccines are largely available and accessible, and they are today, and to a point where the large majority of the province is vaccinated. And we are at that point today. We have about 70% of our population is vaccinated. Of our eligible residents are fully vaccinated, and they have a very high level of protection to COVID, and in particular protection to the severe complications that can arise when you contract COVID. With regard to requiring widespread proof of vaccination, as much as I would like to and have asked numerous times, but I would like to see every eligible person in Saskatchewan get vaccinated, I also firmly believe that being vaccinated is a choice. And creating two classes of citizens based on your vaccination status is a very difficult and it's a very divisive path for a government to take. So in Saskatchewan, it will remain a choice. But you need to also fully understand the serious potential consequences for yourself and for our health system if you choose not to be vaccinated. So that is why today our government is taking a very focused action and is taking that focused action to focus on our vaccine uptake and to ensure that our healthcare system also has the ability to flex and to respond to facilitate the increased demand that we're now experiencing. And I would just say this to the residents of Saskatchewan that have chosen not to be vaccinated: it's never too late for you to go out and do the right thing. The evidence is overwhelming. Look at the evidence. Now is the right time for you to make the decision. Now is the right time for you to go out and access one of the many vaccines that we have available in this province. Dr. Shahab, you have a few comments?
Yeah, thank you, Premier. So I won't go over all the areas that the Premier raised, but I did want to emphasize that we did release our August breakthrough data on Tuesday, and that continues to confirm two things. One is obviously being vaccinated protects you against serious outcomes and protects others around you from getting exposed. And one of the, obviously I work very closely with medical health officers, and one of the challenges that medical health officers were facing with rising case numbers was unvaccinated contacts as well as cases isolating to break the chains of transmission, primarily in communities that have low vaccination rates and primarily in networks that were linked to each other, young people who were linked to other young people, for example, who were unvaccinated. So the order to isolate if you're unvaccinated or a close contact who's unvaccinated, I think will not only address transmission chains, but there's also an incentive to get vaccinated because, obviously it has an impact on what you can do for the 14 days you have to isolate as a close contact or the 10 days as a case, and hopefully break those chains of transmission. We also, unfortunately, know that while vaccines are very effective, if you are older than 70, if you have immune suppression, In some cases, it can result in hospitalization and even, unfortunately, in death. We haven't seen deaths to that extent, but even then, what we've seen is concerning. Other jurisdictions are reporting that as well. So that is why, as the Premier said, we are looking very closely at each hospitalization and each death, based on age, what are the underlying risk factors. We already are starting third doses for severely immune compromised as of September 7th and for long-term care and personal care home residents. But we will continue to expand the eligibility for immune compromised. And then based on what we're seeing in terms of hospitalization, how far ago were the vaccines given, or what are the underlying risk factors, additional doses. But I have to stress, while this is important for the fully vaccinated who are still at high risk, the risk is primarily for those who remain unvaccinated, and we are seeing hospitalizations in every age group, including under 11, those who cannot be vaccinated. And we are, although the hospitalization rate and death rate is much lower, because of our high case numbers, we are seeing, significant hospitalizations because of our high case numbers. I also wanted to mention here that, as the Premier said, there are certain settings like essential settings, not just healthcare, but education, other settings where those are essential services where students don't have a choice if they're under 11 to be in school, where it is the duty of care to be fully vaccinated, and there is no reason why healthcare, education, other sectors should not have, in my view, 99% vaccination rate, and some settings have achieved that, and there's no reason, because the only reason not to get vaccinated, I've heard of only a handful of people who have allergies to a particular vaccine or have any other specific contraindication. So I think it is a duty of care to get vaccinated if you provide essential services. And as a member of the community, if you have children in school and as parents you're unvaccinated, I think you're failing in your duty of care to your community and to your school. If you are visiting friends and relatives and are unvaccinated, you're failing in your duty of care to your friends and relatives. And if you are working in any workplace, you are failing in your duty of care to your colleagues. And the responsibility there lies with both the employer and the employees to maintain a safe workplace, which includes being vaccinated. And my last comment would be around masks. As we can see here, we don't work consistently together on a day-by-day basis. If I work consistently with 2 or 3 people in an office and I'm comfortable, everyone's fully vaccinated, we can choose to work in a closed environment and not wear a mask, as long as we're comfortable. If we're not comfortable, or someone has immune suppression or has any other concerns, we'll all wear a mask. But if we're in a public space where we don't know who's vaccinated or not, it's a good idea to wear masks in indoor places for everyone, because if you're fully vaccinated, you're less likely to get seriously ill, but you can transmit at lower numbers, especially when our transmission rates are high like they are now. And as we enter into the fall, I think we will have to look at all the tools that we have, vaccination, re-looking at social distancing, mask use, other measures, rethinking our gatherings, indoor gatherings, whether private or public. While there are no restrictions currently, we will have to rethink as we get into the fall, as we do. We had a great summer outdoors, didn't have to wear a mask on the beach, walking outdoors is still safe without a mask. But I think at our current case rates, we are looking at a significant surge unless we course correct and start taking measures. Already we see that. We see more mask use in busy indoor settings. We see people adjusting how they, what kind of gatherings they're having, who's coming, are they vaccinated. And I think that's something we'll have to watch closely, because the current trends do point to continuing high case numbers and unfortunately hospitalizations. Thank you.
We'll now take questions, and we'll start with the room. Laura?
Premier Mo, 2 Fridays ago, Dr. Shahab said it was his professional opinion that a mask mandate indoors would be a good idea, and that a vaccine mandate for non-essential events and services would be a good idea. A letter from medical health officers across the province also unanimously stated that mask mandate would be a good idea. So why, still, are you not following Dr. Shahab's advice on the advice of medical health officers, at least in areas like Saskatoon and Prince Albert, where cases are skyrocketing again?
A few things. With respect to the decisions that we come and I've said this before, the decision-making process that we go through with Saskatchewan Health Authority officials, Scott Livingstone, Dr. Shahab, his team, the government of Saskatchewan and others, is we have a collaborative discussion and we look at the options that we have as we move forward to put restrictions in place, to remove restrictions at certain times, and that process is the same today as it has been throughout the process. With respect to masks, where we are today is when we removed the emergency order on July the 11th, removed the public health order with respect to the mandatory indoor masking policy that we had in Saskatchewan. We also had said at that point that masks for the most part have been normalized in society, and you are going to see people wear masks, choose to wear masks as we move forward. And I think you're seeing that. I see that when I go out each and every day with a number of people are wearing masks when they go indoors. As Dr. Shahab had said, if you're with a different cohort of people, that is a good idea to be wearing, a mask if you're going to be in close contact with them. I carry one with myself as well, and I do put it on when I feel it is necessary. As we move forward, the recommendations around masking remain the same. We have a number of other significant recommendations here that are really addressing what is the most effective tool that we have in reducing our COVID case numbers in this province, reducing ultimately our hospitalizations in this province, and that is for people to make the decision to go out and get vaccinated. I had said a few weeks ago that increasingly, as we move forward, if our cases continue to increase, it is going to be increasingly more uncomfortable to be unvaccinated in this province, and I think with the measures that we're bringing in today, then most certainly it is going to be increasingly more uncomfortable for those that are unvaccinated to visit a number of different venues in the province, and we're seeing the proof of vaccination, and we're working with many organizations on instituting a proof of vaccination, a proof of negative test policy. We're doing it across our healthcare sector more broadly, and we'll be doing that in the next number of days. We're seeing large events and organizations doing that. We've seen our post-secondary institutes go that way. We're seeing some municipalities as employers go that way as well. And ultimately, as we move forward, a number of the public health measures, and I would say they are never off the table. If our cases continue to increase, we continue to have conversations with Dr. Shahab and our teams, but we strongly feel that the best tool that we have in this province and across this nation in battling the COVID-19 pandemic and the numbers that we are currently seeing here today in case numbers and our hospitalization numbers is vaccinations, and we're making a renewed effort here today to encourage the uptakes of vaccines in our communities across the province. We'll be on the phone with leaders across the province in any areas where our vaccination rates are lower. Multiple ministers and health officials will be on the phone to see how we can work together to push those numbers up. We've made the changes with respect to the health authority. We've made the changes, and the public health order will be back in place with respect to those that are not vaccinated, that come in close contact with a COVID positive person. They will be required to isolate. And so these are significant changes that we're making here today. And they're significant changes designed to encourage people to rethink their decision about whether or not they are vaccinated.
Yes, please. My second question is that Saskatchewan has the worst case rate in the country per 100,000 at this point in the pandemic. As you and Dr. Shahab have said, most of the cases right now that are in hospital and ICUs are those who are unvaccinated. However, healthcare workers, doctors and nurses are saying they're burnt out, they can't take much more of this, but yet there is, on September 13th, an emergency labor measure that could go into place. Please talk about burnout in the healthcare system right now amongst doctors and nurses.
Scott Livingstone may have something to add, but with respect to the changes that we're making and going to the private sector to procure some of our diagnostic services, some of our testing support, some of our contact tracing support, we're going to be transitioning some of our PSC staff back in that are already trained back into our contact tracing effort to free up some of the healthcare staff that we have so that they can provide support to those that are working in areas where the pressures are real. And that is in our ICU departments, where the pressures are very real, and we are making efforts now to ensure that we can free up staff to support those folks that are currently working in those areas. You might want to speak a little bit to the slowdown, which will really mirror what we did earlier in the COVID pandemic, and how that will free up a significant number of people to provide that relief that has been asked for over the course of the last number of days.
So just to follow up on those comments, as we now are in the fourth wave and have seen the staff that have worked hard tirelessly for 19 months, it's often we forget that the challenge is also service resumption. So at the same time, we're now dealing with an increased COVID load. We brought back up all those services we had slowed down for the third wave. So as part of the strategy to reduce the pressure on staff and assign them to those duties that are going to be most important over the next few weeks, as we see cases rise, is to slow down the system again, which we've done before as part of our defensive strategy to build capacity to address both our COVID and our non-COVID pressures. But as I think you've seen, one of the concerns we have is not just the burnout and the stress in the staff, but it's the non-COVID patients that are coming into the facilities, and the fact that after 19 months, across this country, there have been unmet health needs in these individuals, and it's how we will continue to try to address those. The reality of the situation is with the caseloads that are coming, everyday healthcare services will not look like everyday healthcare services because of this service slowdown. We have, in the third wave, as you know, we didn't do, system-wide shutdowns like we did very, very early in the pandemic to bend the cost curve. We did targeted slowdowns, given the pressures that you've actually already raised with PA and Saskatoon. We certainly are looking at how to build more capacity and use the entire provincial healthcare system to support our tertiary centers and PA, which are on extreme pressure right now with the growing caseloads. So it's a strategy of, trying to reduce the workloads and assign them to the work that's most needed. But at the end of the day, you're right. It's a challenge across this country, across North America, what's happened to healthcare workers who've been on the front lines. Since you opened the door, I am going to comment on, one of the other things that's changed, in the early part of the pandemic, we had people thanking healthcare workers and banging on pots. And today we phone cases that are COVID positive, and all they seem to be able to do is swear at our staff and treat them in a bad way. That's happening on social media, it's happening in our facilities, and has to stop.
And Saskatchewan people, I would say, are better than that. The best way for us to reduce the workload in our ICU departments is for people to go out and get vaccinated. We have said from the outset of this pandemic that we are focused on two things primarily. One is accessing vaccines and making them accessible to people, and those are available today. Two is to preserve the capacity that we have in our healthcare facilities, and we have now about 70% roughly of our citizens in this province are fully vaccinated, meaning about 30% are not. Yesterday we had a 286 person case count was our positive COVID ID count yesterday. 43 of those individuals were vaccinated, which means 243 were not. 43 individuals from the 70% of our population were positive with COVID. 243 from 30% of our population, the unvaccinated portion, were positive from COVID. The best tool we have, the best defense we have, the best option we have to reduce the pressures on our ICU department today are for people to go out and get vaccinated.
And I just want to add that some of the distress that healthcare workers feel, obviously there's burnout from not being able to take your vacation, not being able to be with your own family, but the other is the moral distress and moral hazard of the fact that imagine if this was polio and we still had to have children in iron lungs. I think that is very distressing that no one could have anticipated, I think 15 months ago, that there will be such a safe and effective vaccine for a coronavirus. We have a safe and effective vaccine. And it is unfathomable actually to people who are fully vaccinated, why so many people choose to remain unvaccinated. The surprise, anger, grief that patients and families feel, in some cases ongoing denial when they're hospitalized, the pain and suffering that comes with being hospitalized, with being intubated, the fact that if you did not accept a safe and effective vaccine, which 95% of us accepted as children, we were all fully vaccinated with polio, other vaccine-preventable diseases that no longer exist. Why we did not accept that for ourselves or for our children, I think that is also weighing heavily on the hearts of healthcare providers, but also on the hearts of friends and family who chose to remain unvaccinated and now are hospitalized. There's a lot of grief there, and I think it causes all of us to stop and reach out to friends and family who remain unvaccinated and help them address whatever misinformation they have. If they have any phobias around needles, staff can help with that. There's lots of interventions that are routinely done for other vaccines, and it is a sign of our times that there's been so much misinformation around COVID and around vaccines. But I think, this really needs to be addressed, because otherwise we will have an unthinkable situation of significant ongoing, not just case numbers, but hospitalization and death from what is now a vaccine-preventable disease.
Nathaniel?
Premier Mo, Mr. Livingstone, you just spoke about how frontline healthcare workers are suffering abuse from COVID. Now, frontline healthcare workers are also protesting their governments that are calling for more regulation, especially vaccine mandates and especially mask mandates. You're implementing some new measures today, but not those, and especially those two, which they say will help because they're struggling. They're using words like drowning to describe situations in the ICU. My question is, what message does that send to frontline healthcare workers who are asking for more help?
I think the protocols that we're putting in place today are twofold. One, we are, and they're significant. They're significant in encouraging the uptake of vaccines, which ultimately is going to be the way for us to reduce the pressure on those frontline healthcare workers. Two, significant measures in what we're doing here today in procuring private diagnostics and procuring third-party partners to do testing, to do contact tracing, to free up healthcare officials so that they can support those very healthcare folks that are on the front lines, that are in our ICU department. The decision to do a slowdown on elective services that are being provided across the healthcare, across our healthcare service in Saskatchewan are not taken lightly. We are doing that so that we can provide that assistance to those very folks that are asking for it, because the challenges that we are seeing in our ICU departments are very real, and they do need the support, and that support is on its way. And the incentives, the protocols that we are putting in place to encourage the uptake of vaccines today also are significant, and it is our true hope that they are going to have an impact on our vaccination rates as we look ahead. Scott, do you have anything to add?
So the only thing I would add is that, just again, focusing on the fact that we're building capacity to deal with the fourth wave of COVID is putting us in a state in this journey of COVID, this is unprecedented for the healthcare system. It's not just our inpatient beds, it's the emergency rooms, which we've seen challenges with patient flow. And as we do this, I want to make sure people understand is as much as we will try to target reduced services to build capacity for COVID, that's not going to slow down the disease, and it's also not going to address the fact that these are not going to impact just people from Saskatoon or Regina or PA. This will impact every resident of the province. Every resident of the province, whether you live in Raymore or Kindersley, Rosetown or Lloydminster, will be impacted by these changes to the healthcare system as we deal with the COVID pandemic. As we've talked about a lot, and I don't want to be this being construed as negative, but it's hard to live it. When you live in a glass house, you don't throw stones. The vaccination rates in healthcare workers in this province mirror the vaccination rates in the general population. So as the Premier talked today, it's why we're in discussions with our labor unions and other partners around how can we address this vaccination problem. We know as stressed as healthcare workers are, as challenged they are to do their jobs each and every day, those slowdowns will help, but vaccinations are truly the most definitive tool we have to slow down this virus, and we've stalled, and that needs to change. The other orders, they push it down the road and help us reduce some of the peaks, but the reality is the cases we're seeing today were infected 2 weeks ago, and the cases we're going to see in 2 weeks, which will be higher, have already occurred. So building capacity in the healthcare system is an immediate need, and that's why we're moving forward with that today.
Follow-up?
But you're being reactive, not proactive. You're asking for mask mandates. And I would ask then, why would vaccination uptake be different this time? This is for all three of you. When you touted the many measures you took last time, outreach services, clinics, why would it be different this time than it was last time? Why would people get vaccinated now instead of earlier when it was so easy?
Well, now, what we are facing, we had the lifting of the public health orders and the emergency order on July the 11th. And now we are re-implementing a public health order with respect to those that may come in contact with a positive COVID person. They are going to be required to self-isolate for 10 days, and we're bringing in the contact resources to be able to inform those people of that. So that public health order, it will be back. If you are vaccinated, you'll be asked to self-monitor for those 10 days. There's a significant difference in self-isolating, between self-isolating and self-monitoring, and there will be an incentive for people then to reassess their decision, if they have not done so already, of going out and taking one of the highly accessible vaccines that we have in the province. I would just say the challenge that we are facing here in Saskatchewan is not specific to Saskatchewan. COVID is not exclusively a Saskatchewan challenge. You look across Canada, we are seeing the fourth wave of COVID in various provinces. We're seeing it south of the border throughout North America as well. And what we are doing, this maybe lends back to your previous question as to the folks that are working largely in our ICU departments that are carrying an inordinate load at the moment. That help is on the way, and we are making the decisions to provide them with the supports that they've been asking for, the supports that we feel they require through various mechanisms here today. And we're also bringing into play significant measures to encourage the uptake of vaccines here in the province. Dr. Shahab, do you have anything to add to that?
I think there's a couple of things. One is that I already said that, just changing minor things in our lives today can have immediate impact. Mask use, reducing a number of contacts, minor changes can immediately reduce transmission, and that can show in lower case numbers 4 or 5 days. Vaccination, obviously, we need to go up by 5, 10, 15% very quickly to have an impact on the surge, because the trends currently suggest that our case numbers will continue to rise significantly, and so will our hospitalization. So any measures today to address pressures may meet demands today, but may not meet them 2 weeks, 4 weeks down the road. So that is why vaccination rates need to rise dramatically, not the 0.5% per week we have been seeing. And then the question you asked, I think, is very important, that why are people choosing to remain unvaccinated? And that is very complex. Why does, if you look at Saskatoon by neighborhoods, why are some neighborhoods 80-85% fully vaccinated, and some neighborhoods less than 50%? And if you add, the entire population, including 11 and under, much lower than 50%. And there, the Saskatchewan Health Authority and partners are providing easier access to vaccinations, but addressing any concerns or phobias or access issues. Many people may have jobs where they can't get time away, so I think there's a role for employers also to support their employees to get vaccinated. The issues in the north may be very different. There may be issues of trust and other issues. I do have to say that, and I work very closely with medical health officers, work closer to communities, but there is an opportunity for faith leaders, other community leaders in the north, at the municipal level, at the local level. And it's not just leaders who work at a municipal level who are showing great leadership with, mask mandates at their level, but also other leaders who have influence, like elders, and many have already done that, but continue to work with young people who remain unvaccinated. And then, there's no easy answer for people who continue to get all their information from social media misinformation sites. Like, I do think that there is a population who is not really still accessing the best data on vaccines, the fact that they're very safe and effective, and they're still looking at, and there's no easy answers for that. And I think it is really up to close friends and relatives to reach out and help people who still are in denial about the benefit the vaccines bring, and about the fact that how serious COVID can be even if you're young. So I think it's a complex answer. There's no easy solutions. Some of these measures, like incentives to get vaccinated, disincentives to remain unvaccinated, they do work, but there's not one incentive that works for the entire population. So I think that's an important area that is very much specific to which, the population. And I think it's all of our responsibility to reach out in whatever position we are in, as family members, employers, and other relationships to encourage vaccinations.
Karen?
I just follow up on something that Peter said. You said COVID was not specific to Saskatchewan, but our response is very different than other provinces. We're the only province in Western Canada that has a mask mandate right now. Most Canadians live in a jurisdiction with, people vaccine requirements. Why should people have faith in your response, since it is very, you have to acknowledge that it is very different than other provinces in Canada?
I don't think it would be classified as very different than other provinces. You're going to see variability among all of the provinces across Canada with how we have managed the COVID-19 pandemic throughout. You also see many similarities throughout Canada as well. What we have an opportunity to do in this province, and what is the most effective tool that we feel we have, and as people in Saskatchewan to combat COVID-19, and most certainly is to increase the uptake of vaccinations that we have. We are making an effort here today with some of the policy that we are introducing and some of the protocols that we are introducing that are going to do just that, not only with respect to some of the employees of the government of Saskatchewan, but as I said, we're continuing to work closely with others, large venues, other employers across the province on how they can enact also proof of vaccination, proof of negative test policies. And ultimately, as we find our way through COVID, it will be through increasing our vaccination rate. The numbers speak for themselves, and I said them earlier. It is the vaccines are by far and away the most effective tool that we have, and everything that we can do to focus our efforts on increasing that rate of vaccination uptake ultimately is going to allow us to alleviate the pressures that we have in our hospitals, reduce our case counts, and get to a better place here.
There's speculation, and I'm sure you've heard of it, that our response to Saskatchewan is you're listing choosing anti-vaxxers, that you are having a cleaning your party that doesn't want, multi-learning systems. Do you announce to people who, go and protest in front of the hospital and, obviously spread misinformation? What is your feeling there? And I'd love to hear from Dr. Shahab as well.
Yes, I will denounce and condemn people that are protesting in front of any of our healthcare institutes here in the province. We are the appropriate place for that type of a policy disagreement would be at the provincial legislature in Regina. Our healthcare folks that are working in the hospital, in particular those that are working in our ICU departments, do not need to hear those types of protests. They have their hands full with what the work that they are doing, caring for our family residents each and every day. It's highly inappropriate for you to have a difference in policy view from this government or people in the province, and to do that in that particular place, given the circumstances that we have here today. With respect to this government's and the decision-making process that this government has gone through over the course of the last close to 20 months now, nothing could be further from the truth. There's not an influence of anti-vaxxers or those sentiments. What we are trying to do and continue to attempt to do is to listen to the best medical health advice that we have available to us, and Dr. Shahab. And I appreciate very much the effort and the advice that Dr. Shahab continues to provide to all of the people of Saskatchewan, and to listen to the people of this province on where we are with our COVID response, and to ensure that we are representing the bulk and the majority of the people of the province of Saskatchewan. We're going to continue to do that throughout this COVID-19 pandemic, and that's why we're taking the significant measures and implementing the significant measures that we are here today. Dr. Shahab, anything to add?
Yeah, I think I just want to, based on your comment about variations across provinces and also countries, I think that again is a really important point, and ultimately in democratic countries, elected governments make those decisions. But from my side, I think all recommendations and options will have to remain on the table. And if you look at European countries, for example, unfortunately some had to go back into strict lockdowns, either nationally or at a local level, like in Spain and other countries, Netherlands, for example. Some countries like Israel had to give widespread booster doses in an attempt to drive down very high case numbers, equivalent to 1,000 cases per million. Some countries like the UK have been managing a fairly high hospitalization load without putting in measures beyond recommendations for mask use in crowded indoor public places. in the U.S., in southern U.S. states, they have 2 to 3 times the hospital capacity that Canada has. They have maybe 10-15% lower vaccination rates. Their hospitals have been overrun, and I think no one wants to talk about it openly, but again, area of distress for healthcare providers in the U.S., and that could happen in Canada, is then who gets the ventilator? Is that a 60-year-old with a heart attack, or a 40-year-old who chose not to get vaccinated and needs a ventilator? I think that is an unthinkable scenario which we thought could happen in March last year, but because of lockdown and other measures, that didn't come to pass. That can still happen in Saskatchewan, and I think that is why all measures need to be on the table. No one wants to go there or think about it, but I think if you look at the projections from the U.S. and now some of the northern U.S. states like Washington and Oregon, still slightly lower vaccination rates than us, but significant capacity issues in hospitals. So I think, unfortunately, all options need to be on the table, but ultimately the suite of options sometimes bring unintended consequences like we had during lockdowns on everyone versus unintended consequences on people who are unvaccinated, but many of them currently would be, not to be able to attend non-essential areas versus, having to continue to see for many months a fairly high hospitalization rate, which again has unintended consequences because, like Scott said, urgent care can be delayed. Elective care is not unimportant care. I mean, elective surgeries, cancer or other surgeries are still important, and if they are continuously delayed for weeks or months, that is also not a good outcome. So I think all measures need to be on the table and need to be applied to preserve the health system capacity for all illness, not just be COVID specific, but also, manage things in a way that minimizes unintended consequences, at least for people who are fully vaccinated. And then, there's limited options beyond incentivizing immunizations, disincentivizing remaining unvaccinated, and mandating it, in terms of a vaccine or test approach in essential workplaces. But I think the policy responses are complex, but they are essential that we look very carefully to where our trends are going to go over the next 2 to 4 weeks. And right now, I would stress that unless all of us relook at everything we're doing and reduce whatever we can do in terms of transmission risk, the trends are not pointing in a safe direction right now.
Just to add on Dr. Shahab's comment about unintended consequences, for every consequence that is put in place, there is the effort to control, in many cases, the spread of COVID by that protocol. But there are unintended consequences to many of them. There are unintended consequences that arrive when there's a slowdown in the healthcare system, and we've seen some of those as we ramped our healthcare system back up the last time we slowed it down. There are unintended consequences to individuals when they are required to isolate for extended periods of time. There's unintended consequences to widespread lockdowns as well that we have seen and will continue to see in this province, this nation, and around the world for some period of time. And I think it's incumbent on all of us just to, again, recognize that COVID-19 is by far and away the largest challenge that this generation has had to face. We haven't had to face a world war in this generation. This is our challenge. This challenge is exerting pressures and it's exerting stresses on individuals. I see that in my family, I see that in my friends, and I see it in our community. It is bringing out the very best in people, and it is bringing out the very worst in some people due to those stresses and due to the challenges that we are facing as individuals. We need to continually focus on putting forward our very best as people.
Thank you for taking my question. I just want to ask you on this data Mr. Livingstone, can you tell us a little bit more about what services will be impacted by the program and by what percentage?
And the regional nature of them.
So we're just in the process of getting the service slowdown work approved and implemented. We do need to be able to execute on service slowdowns to the full extent, the letter of understanding or some mechanism in place that allows us to move staff where we need them most. In some cases, for example, and it would likely, like I said, it's not the entire province is shutting down that occurred in April of 2020. It's what we've done on an ongoing basis through the last few waves is targeted slowdowns and load leveling services. So if Saskatoon's ICUs go on bypass because they're full, we would transport patients to Regina, just like we did when Regina's ICUs were full in April, and that's how we use all of those resources. So more will be coming out in the days to come, but it will be, in some cases, 100% slowdowns of certain services. For example, elective surgery in some facilities might slow down at 100%. In other cases, it might be maintained at 90 to 100%, where they're not seeing the same type of COVID. We're not going to, stop it in small, in facilities where we have people and staff sitting idly by. We don't want to impact individuals, but the reality is it's going to. So it's going to be a variety of different services, but many services will be shut down at 100% on a regional basis to support COVID response, both within, the offensive side of the strategy, contact tracing, testing, as well as the defensive side, where we're actually taking highly skilled resources and that have been trained in ICU or trained in emergency or trained in other areas, and put them in to support our ICU folks and our emergency room folks that are just, that are extremely challenged today.
I'm gonna take here a little bit, because you guys talked a little bit earlier about how, children, especially the younger, well, who can get vaccinated, the more effective. Usually causes considering section medicine for this particular section of the province.
Well, I think in some ways we already have. You're right. Children's 5 to 11 are well, under the age of 11 are not now eligible to receive the vaccination. We're hopeful, and I think Dr. Schwab might have something to add on with respect to, we're hopeful that those approvals and that eligibility, at least from years 5 to 11, would open up, we're hoping sometime this calendar year. And that would, we would then make those vaccines readily available to those that chose to make themselves available to those. But when you look at the recommendations that the province had with respect to our back-to-school efforts this year, we had recommended that those under the age of 11 and under should wear masks in the areas where they're going to come in contact with other people. And you saw this largely, not all, but largely the majority of school divisions have moved on that mask wearing in those settings where students are coming in contact with one another, in particular those students that are not eligible for a vaccine. Dr. Shahab, you may have a little bit on when the eligibility may be and the risk of severe outcomes of children versus elderly.
So I think there's two parts of this question, and thank you for bringing that up. So I think one of the hardest decisions last year when there was no vaccine was limiting children's extracurricular activities, sports, other activities, because on the one hand, while thankfully children are not as severely impacted by COVID, they bore the brunt of restrictions to keep their parents and grandparents safe. So I think we need to recognize the sacrifices last year that children, youth, and young adults made to protect people who were older, and the unintended consequences that the people mentioned on their mental health, sense of well-being, sense of social connectedness. But that was last year. This year, obviously, and we did an analysis actually, and my colleagues in Saskatoon did that analysis just yesterday, and it's pretty obvious that for the most part, children in households that are unvaccinated, where parents are unvaccinated, siblings 12 and older unvaccinated, are the ones who are getting impacted for the most part in the community, in networks, friends, family who are unvaccinated. And then yes, there are repeated multiple importations into school. Last year we did very well where schools did not result in accelerating transmission. This year it's more tricky because we want to encourage a more normal school year while mask use is effective in reducing transmission by about 30 to 50%. It's not 100%, and we want children to engage in activities within school, after school. So it is complex. And I think it gives us pause why, as parents, would we choose to remain unvaccinated and put our children and their friends and family and their schools at risk? My earlier comments about duty of care and failing to maintain that duty of care. And that applies to teachers and others who interact with children, daycare operators, others. Is there a 99% vaccination uptake? And if not, that's a question for all of us. And then even though vaccines are available now, 12 to 17, many parts of the world not there, we still have around vaccine uptake in the high 60s, I think, and in some parts of the province in the low 40s or low 30s. And so even though vaccines will be available 5 to 11, obviously families who are already fully vaccinated will jump at the chance and do the right thing. And families who remain unvaccinated will choose not to get their children vaccinated. This approach, attitude was unthinkable in 2-3 decades ago. Would society have accepted half the population remaining unvaccinated and being in iron lungs for polio? Why is it happening today? It's certainly it's astounding and unthinkable, and I think it gives us pause to think, what is the solution to this? Because yes, vaccines will be available next year, maybe for children 5 to 11, but the uptake, if we go by current trends in parents of those children in various parts of Saskatchewan, certainly does not give us great optimism for the uptake in children. And I think we need to start thinking about how do parents first of all get themselves vaccinated, because till vaccines are available for children, the best protection for children is everyone around them who's 12 and older is fully vaccinated. And if you can't even do that, I have little faith in the impact of vaccines being available to children 5 to 11, obviously protecting children who will be denied getting vaccinated by their parents.
Okay, so yeah, going back to contact tracing, how many people are kind of tasked with that right now? How many people are you looking to have working on that? And did Saskatchewan lower the people that were working on contact tracing when case counts were low?
Yeah. So at the peak of contact tracing, we had about 1,000 individuals involved in, there's 6 different areas of contact tracing. Not all of them are clinical requirements, the daily case follow-up, and we used resources from Stats Canada and PSC. We are actually looking at those resources again, so it was 1,000. And yes, through every wave, because of the redeployment of staff back to their regular jobs so we can deal with the backlog of non-COVID patients and their needs, we did reduce the contact tracing. We set a sort of a daily number. Let's set, if we had 200 cases provincially, we kept just a little over 300 individuals contact tracing. And so as we plan back, we're not meeting our targets on 24-hour notification today because of the workload. So we are, as part of the service reductions and the reassignment of teams, as well as the contracting out of some of the other work to help support, even having the ability down the road to deploy some of the clinical resources that are assigned to contact tracing today to other areas of care, because we think we're going to need it. We're going to need that capacity. So yes, we had 1,000. Today is about 300. We're going back up as quickly as we can. We have asked, school divisions, as you know, to help us out with contact tracing and other individuals. Today's announcement is important, particularly around the public health order, because contact tracing without the ability to enforce isolation, it gets a point with the cases that we would stop contact tracing because we're just simply having such widespread. But that's not the case today. We've got the announcement. We're working on the LOU, the reassignment of staff, and we'll be gearing it back up to the same level it was before, and likely more.
The Premier, none of this was spoken about. Since July 1st, we knew from Maryland possibly about Livingstone. Now we have health services being put down that are now COVID-19. We have the highest 7-day average cases that we've ever seen. And you're reintroducing a public health order when it comes to necessary self-isolation. Did your government's approach fail, and do you take any responsibility for that?
I don't think anyone in July would predict what could or couldn't happen. I don't think if you can predict today what will be in January, February, March of next year. COVID is not something that we have dealt with before in this province or across this nation to the degree that we are dealing with it. We're working together as provinces. We're working together within the province with our our health authorities and various other entities across the province to manage the situation as we see it come and continue, yes, to live with COVID. And we do need to move forward living with COVID. It is not going away tomorrow. It's not going away. One thing we can be sure of is it's not going away in the foreseeable future. And we are going to have to manage our specific COVID situations, how it may impact, for example, our healthcare sector at various times. But we are going to have to learn how to live with this virus for the foreseeable future. The way for us to live with it is with much less impact to our healthcare sector, to our families, to our loved ones, is for as many as possible, if not all of us, to go out and get vaccinated. It is the most effective tool that we have, and as Dr. Shahab says, we are fortunate today in Saskatchewan. We do have access to a large number of vaccines, and they're accessible in virtually every community across the province. And I just once again would urge people to go out and take that opportunity, go out and get vaccinated.
We don't have a way of predicting the future. We do have a way of projecting different scenarios based on modeling. Last week, when the pandemic was limited to various parts of the healthcare system, that letter said our province cannot be reliant on a vaccine strategy, as vaccines by themselves will not be sufficient for a significantly greater proportion of our entire population is fully vaccinated. Clinical modeling predicts that masking may further reduce these cases, hospitalization, ICU numbers by up to 50%. Given that's not happening today, I'd like to know what that modeling says about where we're headed. That's a question for the entire.
Yeah, you want to speak to that,
Yeah.
Dr. Shahab?
Yeah, so again, I think this concept of living with COVID, obviously, till January of this year, it was very different. It was, significant lockdowns or slowdowns throughout the country. And then with vaccinations initially for people who are older, and then for everyone in July, as case numbers came down, it meant a fairly normal summer, mostly outdoors, but indoor gatherings. And now, and then we have to remember that our third wave in Regina was due to the Alpha variant, which even with the Alpha variant, people who were older, fully vaccinated, were well protected, but unfortunately, unvaccinated working age adults were severely impacted. Now we have a Delta variant where initial assumptions, modeling assumptions, where 75% fully vaccinated would to a large extent control COVID transmission. Now the projections are 85, 90, maybe even higher percentage of the population vaccinated on its own is not sufficient to control surges. That's because of the Delta variant. Because even 20% population unvaccinated can still cause significant surges, like we have seen in other provinces that have 75%, 80% vaccination rates. And so that forces, obviously, us to readjust our strategy. And so vaccination alone is not enough, and that's why it's going to be important, especially now with a surge, as we move more indoors, to rethink how we can reduce the number of contacts, how we can use more other strategies like mask use. Now, having said that, obviously we can do a lot more now than we could do before the vaccine era, especially if we're vaccinated. But I think that's exactly true, that right now with the Delta variant, that twice as more infectious, twice as more severe in unvaccinated, it is a different dynamic. And bringing up our vaccination rate very quickly by 10-15% will have significant impact on hospitalizations, maybe reduce them by 30-40%. But there will still be significant hospitalizations that will remain. Consistent mask use will reduce hospitalizations by another 30%, so we can get almost a 60-70% reduction. So instead of 200 people, we'll still have 50 people. But that is if current trends level off. But if they, so it is a complex situation that even a small unvaccinated population who's mostly younger and unvaccinated can still drive such high hospitalizations. But right now the Delta variant is revising all these assumptions, and in future, hopefully, a vaccinated population will still have to face other variants that may have variable vaccine escape strategies, and then in future, will there be future vaccines that will be better addressed to address future variants? Will there be routine boosters? I think that's for the long term. But actually, right now, you're correct that all the assumptions that are true in March are no longer true, because our main transmission right now is due to Delta, not the original strain and not the Alpha strain.
On the, as we're in the fourth wave of this COVID pandemic, or as it's referred to, the fourth wave, what we're seeing here today, not precisely, but in large degree, addresses some of the concerns that you raised in your question, Zach, with respect to the resources being provided to healthcare workers, in particular those in our ICU departments. The reallocation of human resources that we're going to be able to do either through a negotiated LOU or redeploying the emergency order here in the province on Monday if we're not able to come to that point, so that the LOU, the existing LOU that we had in place would then come into effect. You add to that reallocating our provincial staff back into the contact tracing efforts. You add to that the ability and the initiative to go outside and procure some third-party diagnostics, third-party testing capacity, third-party contact tracing capacity is going to allow us not only to address the current pressures that we have in our ICU departments, but will allow us to address any pressures that may be coming at us in our ICU departments and our hospitals here in Saskatchewan as well. You add to that the initiatives that we put forward today to first take care of those that can still be vulnerable to COVID-19, and that is our elderly. And if you go back a number of months, that's who we were talking about, and we're delivering those booster shots today to immunocompromised and those in our long-term care facilities. Will be coming forward with a plan in the next number of weeks with respect to how we will then expand that to likely on an age-based criteria, but we'll have those parameters in the weeks ahead. And then you add to that the significant health measures that are in place across this province, and we shouldn't think that there are no health protocols that are not in place in Saskatchewan. We're seeing increasingly large events, municipalities, post-secondary institutes, now the provincial government moving into the space of requesting a proof of vaccination or proof of a recent negative test. We're seeing some municipalities have instituted a mask bylaws with respect to transit and municipal buildings, things of that nature. So we are seeing a significant public health measures that are in place in this province. All of it, I think, will be effective at reducing the numbers as we look ahead. But we, in many ways, I think we are addressing the concerns that are before us in this fourth wave. And one is the capacity for what's here today and what's may be here tomorrow in our healthcare departments. We're going to address that with the measures put in place today, and addressing and encouraging the uptake of vaccines in our province.
Sorry, didn't hear a clear answer on our modeling that we
So thanks, Zach, for the question. So first of all, with respect to modeling, and I'm going to give you your answer, but I just want to do the backdrop about modeling is not a crystal ball. Modeling has been used for us to plan. So for example, part of our planning today for service reductions is building 80 bed capacity in ICUs for COVID patients and 255 inpatient beds. That's what the teams have been directed provincially to do for this first wave of building capacity. To your point, building capacity does not slow down the virus. It allows us to deal with the outcomes of people being infected. We know that and have had a multi-pronged approach from the start using modeling and the data to guide some of our response, particularly on the defensive side. The offensive strategy includes testing and contact tracing, which we talked about getting back in, and having mandatory isolation is a key piece of that. And then, of course, vaccination, which we know is the most definitive tool. With respect to the numbers, and I tried to address this before, and probably I wasn't clear. So today, this week, as you already pointed out, we have the highest case rolling average that we've ever had. Those cases that we would have experienced occurred 2 weeks ago, right? The hospitalizations, the ICU admissions are going to occur a little bit after that, but with Delta variant, we found it's not that same chain where we're waiting. Case numbers are going up. They're going up significantly, and they've already occurred. We just don't know them yet because we've got, those cases have already occurred, Zach. The cases we're going to see next week and the week after that are going to put pressure on the system, they've occurred. What does the modeling tell us? 2 weeks ago, we had maybe 200 cases a day. Now we're over 300 plus, right? So we're probably going to be in the range of 400, 500 cases a day. That's a guess. But that's what the modeling's telling us, is the numbers are going up. And the reality is building capacity will help us support that. There's a cost to that, as the Premier's already said. That cost is to every single individual in this province who's vaccinated and requires non-COVID care, and those people who are unvaccinated that require non-COVID care, because that care is going to be directly impacted by what's going to happen over the next couple of weeks. So with respect to the other comment that I have to go back to address, is a comment about us being proactive and being reactive, and us being reactive. We or anybody in this world, to my mind, have not been proactive with this virus. We can't be. It changes. We lived every 2 weeks with changes. We have a Delta variant now that is completely different than what we dealt with before. It's 2 times more infective. It's 2 times more aggressive in unvaccinated people. If you're in ICU and you're unvaccinated with the Delta variant, you're going to stay there twice as long. That's twice the pressure on ICUs that we were experiencing before. And we had the tip of that in April. So the reality is cases are going up, and there's nothing today that we're going to do that's going to stop them, because they've already occurred.
I also wanted to say that, the original modeling last year was unthinkable in the absence of no public health measures. And so what happened in March was a fairly significant lockdown. Schools were online, universities were online, only essential workplaces were open. That had an impact. And then in November, in the second wave, and then in the third wave, mostly in Regina and southern areas, the measures were a bit different, because people at least were starting to get vaccinated. And now, of course, the response, has to be looked at in terms of, obviously, a full lockdown would reduce transmission, but at great social and economic cost and mental cost. But then, what are the measures that can, blunt the curve so that it doesn't go that high? And then that's where I think some of the projections say that if we all reduce the number of contacts, and some corporations, for example, that were saying, okay, everyone back to the office in September, now they're saying, no, continue to work from home where you can, reducing the number of contacts. Some people who are planning larger events are thinking of, rethinking that, making them smaller, taking them outdoors, asking people if you're fully vaccinated, maybe having mask use in some settings. So all of that bends the curve down, and bring vaccine uptake quicker than we are at the moment. Half a percentage point a week is not good enough. We really need to accelerate that. All of that has incremental impacts, and that's how, if next week all of us are behaving a bit differently, then the projections start trending in a more positive direction. But if we don't change our individual behaviors as a collective in a week or two, how many contacts do we have? What are our behaviors in terms of mask use? Are we, if unvaccinated, getting vaccinated? All of that has an inputs into the model, and all of that has an impact. But certainly you would want to bend the curve down without thinking of a full lockdown. But again, if the health system can't deal with even non-COVID emergencies, if that was the point, then of course all options would have to be looked at again. But you would think that you wouldn't have to reach that point.
In March, when case count increased in Regina due to the UK variant, there were public health measures put in place even with vaccines. Case counts are surging right now. Why, again, you have answered this, why are we not implementing mandatory masks together with the Delta variant making it so much easier for the virus to spread?
So I'll just speak to that again. So thank you for that. I'll just explain again. So in Regina in March, we had a broad provincial order. But on top of that, what we had was, thankfully, in March, April, we did see large outbreaks in long-term care because they were fully vaccinated. But we did put in significant measures, including bars, restaurants going to take out, and other measures that were significant in terms of economic impacts, other impacts. But they then brought the curve down over 6 to 8 weeks. And obviously, people, working age people, were not able to get vaccinated, and we saw hospitalizations and deaths in that demographic, which were very sad. Now we're at a point, if we take the example of Regina, leading the province in vaccination rates. I don't have the exact numbers, but maybe high 70s first dose, low 70s second dose. Now, of course, if we see a surge, or like Saskatoon is saying, working age adults fully vaccinated are well protected. They may still want to wear masks because they don't want to necessarily get even a mild illness or be responsible for transmitting. So that's the good news. But there are pockets which in a city of Saskatoon, like Saskatoon, you may still have a third of the population who is unprotected, unvaccinated. And because, if you're young, if you're connected through social networks, unvaccinated young people and families are more likely to be connected with other unvaccinated families due to variety of complex reasons. And therein lies the challenge that we still have within Saskatoon a city of maybe 60,000, 70,000 in the absence of public health measures that can still generate quite a lot of hospitalizations. And then what's the measures that can be applied there? Well, incentives to get vaccinated because you may then need to show that proof of that in the coming weeks to go to a restaurant or go to see a show or go to a game. Disincentives in remaining unvaccinated that you will have to isolate as a case of close contacts, but also other measures that all of us can take to reducing contacts. But so the measures may not need to be the same as were put in place in Regina, and ideally they need to be more focused on the existing transmissions and of course contact tracing to reduce transmission in those events.
Follow-up, sir?
Yeah. To switch gears a little bit, why isn't the number of school-aged children who have tested positive for COVID being made available? And is there any sense of what the numbers are?
So my understanding is I didn't check the data today. So we do have data by 0 to 19, 19 to 29. I think data can be made available by 0 to 11, and so that data is either available or can be made available. What we are seeing, we've always seen for the last 18 months that the highest rate of transmission was in people 18 to 29, young adults, socially more active, more likely to work in essential public-facing jobs, and then secondly in older adults, and then children. Last year transmission was lower because schools had many layers of protection, universities were online. Now we are seeing that highest case rates are actually in children 18 and under, and we're looking at what's the breakup 12 to 17 or 12 to 18 and then under 11, and we expect to see this demographic to have higher case numbers, and it is linked to actually not necessarily to going to school, but being in households where parents are not vaccinated either. So there, it's linked to the earlier question that it is the household is the context where you really have to either vaccinate children 12 and over, or everyone. If you're a child under 11, everyone in that household should be vaccinated. That's the best way to protect children.
Last question to Jason.
Some critics have said that you have an unnecessary emphasis on the rights of a small minority. Can you talk a little bit about the rights of the majority, who critics say have a right to a safe environment, to go to places, all of those things, and that would be best enforced through province-wide vaccine task forces implemented in other areas that we're not implemented.
Well, the right I referred to is for everyone in the province. Thankfully, we've seen the large majority of people have made the choice to avail themselves to one of the vaccines that we have provided across the province. We're, I think, nearing 70% full uptake. We're into booster shots for our long-term care residents and our immunocompromised. But listen, as I said at the outset, as we move forward, we are having some pressures on our healthcare system. We're taking action today to provide supports specifically to where those pressures are, and those supports will be available in the days ahead. But the vaccines is the most effective tool that we have in not only lowering our numbers, lowering our case rates, lowering our infection rates, but lowering the pressures that we ultimately have in our hospitals. And so I had said a number of weeks ago with respect, and maybe addresses the question a little more directly, in Saskatchewan, those that are unvaccinated are going to find moving about increasingly uncomfortable. We're seeing that through some of the work that we are doing as a provincial government, and our health authority, Dr. Shahab's office as well, with those folks that are organizing large events, for example. Most notable among them was the Saskatchewan Rough Riders, but there's other large event organizers that we're continuing to work with on with respect to the same discussion. There's employers that we're working with as well as they are looking to institute the proof of vaccine, proof of negative test policy. You've seen us, the provincial government and the Saskatchewan Health Authority as an employer move in that direction here today. We've seen our post-secondary institutes move in that direction. That's tens of thousands of people across the province right there. And we're seeing municipalities have discussions with respect to that. And so I think as we move through today and the next number of weeks, it is going to be increasingly uncomfortable to not have made the decision to go out and get fully vaccinated here in the province of Saskatchewan, and that, I believe, is a good thing.
So I guess just, why not protect, in other words, why not protect the rights of the majority through a province-wide mandate?
Well, I would say that the protection that we're providing as a province is by providing the vaccines and making them accessible to everyone across the province. You know, in the early days when we were, and throughout receiving the vaccines from the federal government, we very early on, I believe it was 14% that we had taken off of the top of every allocation and provided 14% of our vaccines to Indigenous Services Canada to ensure that our Indigenous communities in this province, our northern communities, do have very early and ample access to the vaccines, like other areas in the province that are not as remote or rural as many of our Indigenous and northern communities. And that is an effort that I would say that not all across Canada had made. We had supported and provided resources throughout virtually every community across this province with the different methods of providing vaccinations that we had provided. You know, in the large urban centers, we had our drive-through clinics where we were able to push through and vaccinate large numbers of people each and every day. That isn't available in you know, some far-flung and some rural and remote communities in this province. The effort to get a few hundred people vaccinated is you know, it takes a lot more organization than maybe it does to get a few thousand through some of the high throughput centers. And so that effort continues, and that is the focus of the government. We've said that since the outset, is one is to preserve and protect the capacity in our healthcare system, but two, by providing access to the vaccines that we receive from the federal government. I think we have done that. Now what we are into is likely a third initiative, which is just that. Those that have not made the choice to be vaccinated, they are having an impact on others, and we are now moving into that space of saying that as you conduct your daily life in Saskatchewan and you're not vaccinated, there's some things that are going to be a little more uncomfortable to do. You may have to do some you know, regular testing to prove that you have a negative test if you're going to choose to not be vaccinated. And the goal is that you would eventually make the decision, or sooner rather than later, that it is just simpler and safer to go out and receive your full vaccination procedure.